Hello, everyone. My name is Sally Arif, and thank you for joining us. Today's session will provide some insights into the aspects of professional autonomy and patient justice in pharmacy. Let me introduce you to Miriam, a hospital pharmacist who takes part in ward rounds with the cardiology team. Miriam's role is to review medication orders from the physician and to provide appropriate drug counseling to patients. This is Mr. Gonzalez, one of the patients on the unit who is unemployed and currently does not have medication insurance listed in their medical chart. And this is Dr. Goldstein, the attending physician on the unit. Miriam noticed that Dr. Goldstein has prescribed Mr. Gonzalez a second-line medication rather than a first-line, which is usually more expensive, but recommended by the clinical guidelines to improve survival for patients with heart failure. Miriam reviews if there are any contraindications or restrictions before interviewing the patient to learn more.
Hello, Mr. Gonzalez. I'm the unit pharmacist with the cardiology team. I wanted to ask you about your medication use at home. How willing would you be to start on new medicines for your heart failure?
This is all very scary. My father died from heart problems, and I don't want that to happen to me. I'm very willing to do what it takes to get better.
Do you have any money worries that might affect how you obtain your medicines?
Right now, none. I am unemployed. My last job was not good fit for me, and my boss was unbearable, so I decided to leave. But I have the money saved away to pay for my new medicines and to spend on my health. Of course, I'm willing to hear about any way to save money. I have 2 jobs interviews coming up and my chances look good.
What about spending money on maybe a blood pressure machine or a weighing scale at home?
I tried to explain to the doctor already. I never knew I needed those devices. I am also unsure of how to use them or what to look for. So I don't know if they will help me.
I understand a lot of this is new for you and can be confusing. We can go through why it is important to measure your blood pressure and weigh yourself at home. I appreciate you being honest with me. I'll be in touch with your doctor to relay what you have just shared with me. Thank you. Hello, Dr. Goldstein. I want to discuss the medication regimen for Mr. Gonzalez's heart failure treatment.
Oh, please don't worry about any new medicines for this patient. He probably doesn't have the money for a name brand medication anyway. And he mentioned he doesn't even have a blood pressure cuff or a scale at home to weigh himself when I interviewed him. Most likely he wouldn't take that medication anyway, or it might be too much for him, given his current stress with being unemployed. Plus, the hospital wants us to limit the length of stay for our patients with heart failure, and starting him on a new medication would just prolong his hospital stay. It's best we get him discharged sooner.
I spoke with the patient and he has no financial barriers to medicines use. I can also work with our case manager on the unit to assure that the patient gets a discount voucher for the medicines as well.
You might be wasting your time. We did our best.
Let's review the facts of the scenario. The patient has not been prescribed a first-line medication, and the physician is inappropriately assuming that the patient cannot afford a brand name medication due to his unemployment status. The physician is also assuming that the patient may not take the medication because he cannot afford a blood pressure cuff or scale. This is an example of paternalism, whereby a physician makes decisions for a patient without the explicit consent of the patient and believes their decisions are in the patient's best interest. The ethical principles we should consider in this case are professional autonomy, which means having the authority to make decisions and the freedom to act in accordance with one's professional knowledge base. Because there is often a hierarchy of professional roles, pharmacists often follow the orders of physicians, and their professional autonomy to practice patient-centered care can be limited and advocacy for patients' needs to ensure effective and safe use of medications could be compromised. Patient autonomy is also part of this case. A physician should not override a patient's autonomy to decide whether to take a medication based on their own personal assumptions about the patient's lived experience or circumstances, and in this case, the patient's economic status. Patient justice is where healthcare professionals are obligated to be fair in all their medical decisions as to assure that all patients receive optimal care despite their race, gender, socioeconomic status, or other factors of identity. In this case, the benefits and risks of adding a new medication were not shared with the patient because of the physician assuming that he could not afford it or would not want to take it. Beneficence is also an ethical issue with regard to the physician not providing the greatest opportunity for benefit and outcomes, and thereby potentially causing harm by withholding a medication proven to provide better health outcomes for the patient's illness. There are a number of values we should consider in this scenario. Trust. If the patient or family found out about the physician's intentions, then there would be a severance of trust between the patient and provider. This break in trust, resulting from a lack of integrity on the provider's part, could follow the patient throughout his lifetime and worsen health outcomes in the future. Advocacy. It is crucial for healthcare providers to advocate for their patients, regardless of their socioeconomic status, social identities, or circumstances. Providing equal care across populations is important to achieve positive patient outcomes and reduce health disparities. Empathy. The physician talked to the patient in a condescending manner and failed to consider the patient's side of the story. Developing a more nurturing relationship with patients can result in fewer disputes and greater satisfaction. Harmony of an interdisciplinary team when making decisions about the input on a patient's care. Without the input of an interdisciplinary team, the provider compromises patient care. And by not including members such as the social workers, case managers, nurses, and in our case, the pharmacist, can compromise shared decision-making that can ultimately benefit this patient. Taking all of these into consideration, let's take a look at 3 options for action by Miriam the pharmacist. 1, she can follow the orders of the doctor and withhold the option of a first-line agent from the patient, which can compromise patient outcomes. 2, she can advocate for the patient's desire to achieve the highest level of health and investigate voucher programs or other modes of medication assistance that he can receive to help him pay for his first-line medication at a lower cost, therefore improving health outcomes for this patient. 3, both options can be presented to the patient to allow him to decide, based off his comfort level and evaluation of benefits and risks, what he would prefer to do.
I can appreciate the financial concerns you have for the patient, but I believe he has his own take on this matter, and I invite you to listen to him. I have already established he has the means to pay for his medicines, and he is keen to do so. He will need support and education about the devices, but I am sure that can be arranged.
I didn't realize the patient was willing to take the medicine. And I see your point. Let's ensure the patient gets the best care he needs for the best health outcomes.
Using professional autonomy as a pharmacist, we can advocate for patients regardless of their background, identities, or circumstances. Justice is an ethical principle that requires providing equal care across populations and is important for achieving positive patient outcomes and reducing health disparities. The physician's lack of advocacy for the patient and lack of awareness of the patient's financial circumstances is likely to have prevented the patient from receiving life-saving medications. What would you do in this scenario? Tell us in the comments section.